Hey, everybody. How are you? I know it's Sunday and 5 o'clock. So definitely not a planned live. But you know, whenever information comes that I think is vital and needs to be shared, then, I don't always just, I don't want to wait. So I'll kind of let you guys get in here because I want to give you some information. Why does it look like I have a spot on my lip? Maybe I do. How is everybody? What's up, Tim? Hey, Chris. Hey, Kimberly. Merry Christmas to you guys too. Yeah. So, hey, Ketron. How are you? How is everybody? You guys doing okay? I know that you guys weren't expecting a live, and I wasn't expecting to be doing one. Hey, Crystal. Hey, Angie. But sometimes things happen, and it's important, I believe, to give you information as quickly as I can and as thoroughly as I can. Hey, Hannah. Hey, Terry. Hey, Alicia. Hey, Lucretia. Hey, Shannon. How is everybody? Hey, Amber. Hi, Connie. Hey, Christy. You guys doing okay? So here's what I will tell you is that, hey, Daryl, if you have folks that are in Greenville, I would recommend that they watch this especially. Okay. I would really recommend that. Hey, Mandy, how is everybody? So before I kick this off and get down into the nitty gritty of the things that I want to share with you right now, what I do want to do, hey, LaDonna, hey, Loretta, hi, Esther. What I do want to do is remind you all that the 29th, this upcoming Saturday, is going to be the rally for the Valley at the Kingsport Farmers Market. It will be indoors. We do have, like, Dr. Spivey will be there. I will be there. And we are also asking for, so I'm bringing Bella so she can see her NICU nurses. And we are asking that, any of you all that have NICU babies and NICU survivors, you guys bring them out as well, maybe kind of like a little impromptu NICU reunion. And the same thing with trauma survivors. So if you are someone who experienced a significant trauma and you were treated at Holston Valley, Medical Center, we would love for you to come out as well, because we want to have an opportunity to demonstrate what these facilities have done for the people and for the community. Okay. So do not forget that. It will start at 4:30 on the 29th. Okay. Now, let's go ahead and dig right in. How about that? So, I've been taking a look at a lot of the stuff where Ballad is concerned. And here's what I love about you guys and the folks who are following is I have said to you all, hey, I can't do it alone. You guys help me dig. And I've simply said, hey, we need to look in this direction. And hey, can you look over here? And hey, can you look over there? And tell me what you find. And, and a lot of people have done that, and sometimes it's information that I can use right then. Sometimes it's information that I have to hold on to until I go through certain steps with it, because I want to make sure that everyone is protected and everything is vetted and everything is viable. And then some information I get, and even though we're not finished digging, it's enough yummy goodness for me to just go ahead and throw it out there to you. So one of the things that I think is really important is, you've heard Alan Levine say, for those of you guys who think that we've just made these decisions and we've taken them lightly and, the board has decided all of these types of things. And, it took us months and months to determine these things. I need for you to understand that, sorry, but he's pretty much full of shit. And I'm going to share with you why. Okay. So if you guys remember, the COPA was issued on January 31st of 2018. And after the COPA was issued, it took the state of Tennessee 5 months to hire someone, Larry Fitzgerald. It took them 5 months to hire Larry Fitzgerald to do COPA oversight. Okay. And he was appointed in the middle of May. So that means that Ballad Health, Alan Levine, and all of those guys went 5 months with no oversight. Now, why is that important to you? Well, I want to tell you what happened in April of this year, because, some people might be saying, okay, well, what in the world? Like how did all of this happen and who financed it and what took place? And, there's always a lot of interesting truth that comes out when you follow the money. Okay, so let's talk about the money for just a second. So what we know is prior to this merger, Wellmont had a debt of about $400 million. And everybody always thinks that Wellmont was the one who had just like the worst debt ever. Well, it turns out Mountain States was actually double that. Mountain State's debt was over $800 million, according to the documents that I have found. Now, what happened is there were 4 boards, and this is where I want you guys to pay attention, okay? Just listen very clearly because this is where information gets really interesting. There's a board called the Health and Education Facilities Board. And throughout the geographic service region of Northeast Tennessee and Southwest Virginia, there are 4 of these boards in different cities. Ballad Health went to these boards asking them to buy out the bonds, to issue bonds to cover this debt, okay? Now listen, just hold tight, y'all, and listen, okay? 3 of those boards said, no, we have significant capital projects that we are going to be doing between now and the end of the year, so we're not going to be able to do that. Greenville, however, said, oh, we got you. And here's what I want to tell you. Where did I put my paper? I've been all over the place. So give me 1 second and let me give it to you. Give me 1 second, guys. All right. So here we go. So what happened is in April, this board for the city of Greenville approved a $950 million bond. Y'all heard me say $950 million bond for Ballad Health. Okay, here it is. Now, I'm going to go ahead and give you some information, and excuse me if I have to move the pages all around, but I've got like several screens up and I want to give it to you. So here's what happens. It's called a conduit bond. And there was a guy last night who said, hey, how come somebody's talking about the conduit bond? And I didn't realize he was already talking about something that we had been researching. $950 million was the bond. And it came out in the newspaper on April 27th. And here's what it says: a $950 million bond to assist Ballad Health in refinancing its debt has been approved. Now, here's what's important. Refinancing their debt doesn't mean they got a loan for this. What it means is that their existing debt was refinanced at a lower rate, which saved them $20 million over the course of 10 years in debt payments, which was 2/3 of their COPA obligation. Okay, so their COPA obligation was to, so I just need y'all to hear all of this. Okay, now here's what happened. The board, the Health and Education Facilities Board in Greenville will have no liability for this, and they won't be legally responsible for the payment of the bond, but they're just the conduit. It was actually purchased. These bonds were purchased by BOFA Merrill Lynch, PNC Capital Markets LLC, and U.S. Bank Corp. Those are the 3 bonds. Those are the 3 companies, the financial institutions that underwrote these bonds. Okay, and they were purchased from the board by these 3 companies. Okay, so just keep listening, guys. I know who's in Greenville. Just keep listening. Okay. Now, this is what's interesting, is because this board had been recently reorganized. Just listen. The board had recently been reorganized after having not met in several years during the process of updating the charter for the town. Members were appointed by the Greenville Board of Mayor and Aldermen to fill the vacancies. So let me give you the names of the people. And where the hell's my notebook? Give me 1 second, guys. I need this. Hold on. Okay. Okay, so sorry about that, but just listen. So these guys had not even been meeting for several years, but miraculously they were able to come together on short notice to approve these bonds for Ballad Health. Now, the company that helped facilitate all of this is out of Knoxville. And here's what you need to know. His name is, it's a weird name, starts with an M. The company, his name is Mark Mamontoff. He's an attorney with Bass, Berry, and Sims out of Knoxville. He's who was coordinating this effort between all of these guys. So let me give you the names of the board members, okay? The board members are Rodney Bell, Kent Bewley, Tommy Burns, Bill Hickerson, Brandon Hull, Watson Leonard, and Sam Miller. Now, why are those names going to sound familiar to you? Well, 4 of them are presidents and CEOs of local banks there in Greenville, just so you know. But this is where it gets even better. So, you know, whenever you do something like this to this magnitude, you have to file paperwork with the SEC. Now, I want to be very, very clear. When was the first time Ballad Health submitted paperwork to the State Department of Tennessee about consolidating the NICU? That was on November 12th. That was the first letter that Ballad Health and Alan Levine sent, was November 12th, right? I want y'all to just file that right there, November 12th. That's the first time. When did I say this was approved, this bond was approved? April 2018, when there was no COPA oversight by the state. It gets even better. So on May 18th, first of all, I want to show you this is, see how that says, where am I? Ballad Health. See how that says Ballad Health? And I want y'all to see the date right there. See how it says May 18th? It's a little blurry. Should I pull it back? May 18th, 2018. Can you see it? Hopefully you can see it. All right. So, the Health and Education Facilities Board for the town of Greenville, and this is paperwork that they filed with the SEC on May 18th. May 18th. And it's explaining everything that's coming along and the risks and who's purchasing the bonds from the town of Greenville and all of that, okay? But here's what's important. Now, number one, let me just go ahead and be very transparent. I have not read this entire document because it is 504 pages, and I just got it on my radar today. But what I can tell you is that on page A-24, here's what it says. For the first 5 years of Ballad's operations, the total cost of commitments under the COPA and the cooperative agreement and incremental spending is anticipated to be $297 million. Ballad expects to fund these commitments. Listen to what I just said. Ballad expects to fund these commitments from savings generated by synergies that result from combination. In other words, we don't have the money for these commitments. We're going to combine a bunch of services, reduce a bunch of services, and that's how we're going to pay for these $297 million worth of commitments that we've promised that we could do under the COPA. We don't actually have that money. We just believe that we're going to be able to save that money. And here's how we're going to be able to save it. Ballad anticipates that these savings could approximate $510 million over the first 5 years of Ballad's operations. The anticipated synergy savings shown below are for the first 5 years of Ballad's operations. Listen, folks. Bullet point 1, non-labor spending, $193 million, consisting primarily of contract improvements, elimination of duplicate purchase services, supply and physician preference item standardization and utilization. Bullet point 2, this is where it gets interesting, folks. Pay attention and listen to what they intended for your community. Listen. Bullet point 2, staffing reductions. $119 million, consisting of approximately 350 management and support staff. Some of these reductions have happened as duplicate positions have been eliminated, while other reductions will happen over time as systems are consolidated. Bullet point 3, consolidation of hospital facilities to the tune of $79 million they believe they will save. Number 4, replacement of contract nursing with new employees to the tune of $40 million. Well, here's the thing. You can't hire new employees. Right now, we have nursing shortages because you can't hire anybody to be able to take care of this right now. Right now, There are surgeries taking place throughout the day that should take maybe 9 to 10 hours that are taking 15 and 16 hours because you don't have the beds, which means you don't have the nurses to be able to make sure that people get back to where they're supposed to right now currently. Let's keep going. This one is interesting. Consolidation of surgery center and urgent care operations. Now, remember, I just told you about the day surgery centers that they have merged with USPI effective next month, right? Now, here's what's also interesting. Surgery is considered to be a service line according to the COPA. So if you are making changes to surgery, have you requested approval for that? Have you requested approval for that? Because surgery is a service line and you're not supposed to make changes to existing or future surgery service lines without approval from the state. Next, consolidation of physician practices, $25 million. Consolidation, and here's a big one for you. You ready? Y'all already know what it says, don't you? Consolidation of neonatal and pediatric services. $15 million. Have you heard Ballad Health say anything about consolidating our pediatrics? Have you heard Ballad Health say anything about our peds changing? Now, granted, this is over 5 years, so maybe they just intend to decimate our hospitals a little bit at a time. But I just want you to know that on May 18th of 2018, they filed paperwork with the SEC telling them that this is what they were going to do to the hospitals and to the communities. And they had not asked for permission to do any of this. Now, here's my issue, right? Because these were filed with the SEC. So is there nothing in the paperwork that says Ballad needs to send this information to COPA Oversight? Or is COPA Oversight not doing their job? How much of this did the state know? How much of this does the state know? Because people are reeling right now, and they knew 6 months before they ever filed a single piece of paperwork to the state. Here it says, reduction. Here's what's interesting. It says reduction of one trauma center. It does not say downgrade. It says reduction of one trauma center. Reduction to me sounds like you're going to get rid of it. Doesn't it sound like that to you? It says reduction of one trauma center, $10 million. And the repurposing of acute care beds into other services worth $5 million. Well, folks, there you have it. So couple things that everybody really needs to know, okay? When they say you have to be pretty cynical to think that we would just be making these choices and these decisions and not care. Here's what I think. I do think that, and I'm not cynical. I can just freaking read. It's been about the money from the get-go. They went to this board in April. They got these bonds approved, $950 million bond for Ballad Health from Greenville. Greenville, you want to be upset? Be upset at your board. Be upset at your board. Because this came from Greene County. This came from Greenville. Hold on, y'all. So I haven't even gotten through the rest of this document yet. But it's your local people, guys. It's your local folks wanting to hobnob and get in on a deal and help out their other rich friends and other rich business partners that are causing the heartache that is currently happening for people. They knew in April of last year what they intended to do. And I would bet you money they knew before that. But it was documented May 18th that this was the plan. These are the facts. These are the absolute 100% facts. It's what they plan to do. I'm going to put a link up to this whole document for you. And then I will also put up screenshots because this is just 3 pages. I just printed out the first page so that you would know where it came from. and pages A24 and A25. It was actually Greenville. It was the city of Greenville that did this, not Greene County. City of Greenville did this. Yeah, let me give you the names again. You guys want the names of the board? I don't know that they did anything illegal, Tim. I really don't. I don't know that they did anything illegal, maybe immoral, maybe shady, maybe back scratching, maybe, insensitive, maybe disgusting. But here we go. Let me give you the names again of the board. The board who approved this bond was Rodney Bell, Kent Bewley, Tommy Burns, Bill Hickerson, Brandon Hull, Watson Leonard, and Sam Miller. Now here would be something interesting. Let me just see. I want to just see if I can find something out real quick. Give me 1 second. Let's just see. This is what's interesting. Does anybody remember when because here would be the thing. Here would be the thing, right? When I think about the board was selected originally in November 2017, but then we know that this changed because Bart Hove left like the day before the merger was finally issued, right? So it makes me wonder. Doesn't it make you wonder? So like the people that were on this board, when did the board decide all this? How much? So let me just follow my thought process here. If the COPA was issued January 31st, you got the bond in April of 2018. You filed this bit of paperwork with the SEC on May 18th of 2018, right? So would be my question is, when did the board do all of this miraculous research to figure out if these things were in the citizens' best interest? And when did they weigh all of this? And who decided what? And when did they consult with people? And when have they had time to check out neonatal telemedicine? When have they actually gone and sat down with the folks at Mayo Clinic and said, hey, how did that really work? And what all happened? Yeah, it's 504 pages, folks. It took a while for them to put it together. I promise you, they didn't put together 504 pages between April 27th and May 18th. They didn't do that, right? It's a pretty thorough document. And by the way, Greenville folks, it talks about your hospitals in here. It talks about Walmart had acquired Tacoma Regional Hospital in Greenville, Tennessee as of January 1 for $13.5 million. Tacoma's revenue and expenses comprise approximately 3% of Ballad's totals. Did y'all hear that? And it goes all the way. And then the very next thing it talks about is Laughlin. It says on or before June 30th, Ballad is expected to close on a purchase of a medical office building located on Holston Valley's outpatient campus in Kingsport. The anticipated purchase price is $16.7 million. In October 2018, Ballad expects to open an $18 million micro hospital to replace the current Unicoi facility. Has a hospital opened in Unicoi County? Has a small hospital opened in Unicoi County, guys? Did that happen? Y'all tell me. Did it happen? Do you know? Anybody from Unicoi County on here? Did y'all get a little micro hospital? There's a lot in here and I haven't gone through it, but here's the reason why I jumped on here today is I wanted to let you know in no uncertain terms that Ballad Health knew at least 6 months before they asked the state for approval that they plan to get rid of the NICU. They knew 6 months before they ever asked the state. They filed it with the SEC 6 months before they ever asked the state. They knew they were going to get rid of a bunch of contracted nurses. They knew that they're going to get rid of 350 of you guys, management and support staff. I just want y'all to be, clear on that. Be clear. But I'm going to go back to this one little piece just so y'all have it and can highlight it, because this is important. Whew. Holy jeez. For the first, I'm going to read this and then I'm going to go. For the first 5 years of Ballad's operations, the total cost of the commitments under the COPA and the cooperative agreement and incremental spending is anticipated to be $297 million. Ballad expects to fund these commitments. In other words, this is how we're going to pay for this. Ballad expects to fund these commitments from savings generated by synergies that result from combination. In other words, we're going to get the money because after we merge, here's all the stuff we're going to cut. Ballad anticipates that these savings could approximate $510 million over the first 5 years of Ballad's operations, but they don't really know. So there you go. There you go. They don't have the money. This $308 million they keep telling you all that we've committed to spend, they're going to get the money by all of the cuts that they're making in order to finance that. Because without it, they don't have it. Not right now, they don't. So I just wanted to share that with you all so that you would know. They plan to do all this a whole lot longer than I think many people knew, and definitely before they told anybody. So, when they stand up there and they tell you, we plan to hire X number of doctors and we plan to do whatever. They got a whole lot of plans and no idea where all that money is going to come from. And now here's the scary part. Do you want me to tell you what they say after that? There can be no assurance. This is what it says in the paperwork, guys. There can be no assurance that Ballad will achieve these anticipated savings. If Ballad does not achieve these levels of savings, Ballad's financial performance could be materially adversely affected. See bondholders' risks in the front part of this official statement. Achievement of these savings is dependent upon Ballad's ability to integrate successfully and efficiently the Mountain States and Wellmont systems. Efforts to integrate began shortly after the intent to combine was announced in 2015. Really? They started to integrate? Did y'all read that? Did y'all hear what that just said? It says efforts to integrate began shortly after the intent to combine was announced in 2015. An integration council consisting of senior management from Mountain States and Wellmont met regularly for 3 years prior to the closing of the combination. The Integration Council will continue to manage and track the synergies and integrate and integration efforts of Ballad post-combination. The Integration Council will track the implementation of the integration efforts and will measure progress with regular reporting to management and the board. I'm over these guys. They can't guarantee because they don't have permission to do everything that they've said they're going to do. And this is where it gets really scary, guys. This is where it gets really scary, because what happens if they don't meet these commitments? What happens if them flying by the seat of their pants cripples your healthcare system. What happens if some of these things don't happen or the savings aren't what they projected? So listen, this promise for pediatric emergency rooms and trauma centers and regionalized system of care that's amazing because we're going to spend all this freaking money that we don't have. They don't have it. That's the truth. They don't have the money. They want to shut down a bunch of shit, improve their ratings so that they can get more money from somewhere else and hope it works at your expense. Okay, well, that's all I wanted to share with you guys. Please make sure that you call your officials. This is ridiculous. And then my question to the state and my question to the Attorney General is, how much of this did you know? Because these papers were filed with the SEC in May. Right, Christina, it's a big experiment, and it's everybody else's healthcare. Guys, I know it's the holidays, but don't let up. Do not let up. You call, you email, you let them know. This is not okay. So when I get off of here in just a minute, I'm going to give you a link to this report. Like I said, it's 504 pages. Dig through it. I'm going to be digging through it. Somebody else is going to be digging through it. And we're going to see what we come up with, because I feel like we're just now starting to get to the nitty gritty, you know? Just think about this. How much truth is hidden in 504 pages of a filing with the SEC? How much truth is hidden between 119 pages worth of COPA commitments? Yeah, I always put it, Candy, I always put it at the top of every live. So when I get off of here, I will put the names and email addresses and phone numbers of everybody that needs to be contacted from the health department and from the Attorney General's office. I always do that. I really wonder about some SEC involvement at this point, some DOJ involvement at this point. It really makes me question just who ought to be involved, because this is absolutely crazy, absolutely nuts, you know? So anyway, that's all I got. I'm going to get out of here. I've been working all day and still have some more stuff to do for my regular life. Right, Kim. That's it. So that's the thing. That's the part that is scary, because if they don't approve these closures and these changes, where's Ballad going to get the money from? So it's like, oh my gosh, it's like, let these services change or be repurposed or be deleted and die and get sicker, or they're going to financially fall through. And then what happens to the healthcare system? Like, it is a catch-22, and it sucks. It is going to be up to this entire community to fight and fight really hard. You are going to have to demand that they do right and fix this. Just saying. So I just wanted to give you guys that. You're very welcome. And I will see you guys at the rally on Saturday at 4:30. If you're a NICU mom, NICU grandma, NICU baby, come on out. If you're a trauma survivor, come on out. We really want this to demonstrate the heart and the effectiveness of the facilities within our community. Okay? So I'm out of here. You guys be amazing, be light, be love. Peace.